Hello, good afternoon to all of us once again. Please, can everyone hear me?
Yes, I can hear you.
Yes, Prof. Thank you very much for being online. I know how busy you are. Thanks for coming online. Okay, so this is the first episode of Psyche, targeted at creating awareness around our mental health. For 2024, I believe one of the key things that we should be focusing on is normalizing discussions around our mental health. We should be comfortable discussing our mental health issues, just like any other physical condition. So the KNUST Wellness Center, in collaboration with the Behavioural Science Department, KNUST Counseling Center, and then St. Patrick's Hospital, is organizing this series of webinars to create awareness on mental health. And I believe we will all benefit very much from it. In subsequent months, in the following months that we'll be having these webinars, there are a lot of interesting packages that we'll be throwing your way. For instance, we'll be having reinforcement techniques for people who are bold enough to ask questions or answer questions on the platform, like getting free data. That's in the pipeline for the next session. And then we'll be having mental health assessments every month. So if you are interested in having this assessment at your doorstep, you don't need to come over to any center. All we do is to send a packet to your email, you respond to it, and then we help you assess your mental health. If you are interested, you can send your email to the chat or to me privately so that we can take note of it, and then we'll just add you to this interesting package. For staff and then students of KNUST and that of St. Patrick's Hospital, this opportunity is open to us. We are going to be assessing ourselves every month on our mental health. Yes. So without further ado, welcome to the first episode of Psyche. I'm hoping someone gets a response for us so that when we say Psyche, we'll be able to respond. This year we are normalizing mental health discussions. Our speaker is ready. Our speaker is no other than Dr. Aaron Kuubagr. I have to take exceptional care in mentioning the surname, otherwise I'll just bite my tongue. He's online presently. So he's a clinical psychologist and also a lecturer with the Behavioral Science Department. He's going to walk us through what mental health is all about. What is mental health? What is not mental health? We hear a lot of misconceptions out there, and these misconceptions just reinforce our beliefs about this mental health, and it makes the whole name itself, it stigmatizes the whole name itself, such that even if you introduce yourself as a mental health personnel, you are looked on like in some way. So what is it all about? Let's delve right into it. Doc, please welcome to today's segment. So let's all welcome Dr. Aaron Kuubagr, a clinical psychologist and also a lecturer at the Behavioral Science Department, here to walk us through what mental health is all about. Dr. Floor is yours.
Okay, thank you very much, Ms. Ohiniwa, for this opportunity given me to do this presentation today, creating awareness of mental health in KNUST. Give me some time to just share my slides so that we are able to hear each other. Give me a minute for me to share my slides.
Yes.
Okay. I said that I was given the topic to discuss with us mental health, but I have also decided to reframe the topic to suit what we are doing this afternoon. So I reframed the topic for our discussion, and so I'll be discussing with us on the topic Understanding Mental Health, a comprehensive overview with focus on DSM and ICD. So what are we going to look at in this presentation? We want to look at what mental health is generally. We want to look at what mental health is. Then having looked at what it is, then we'll look at some common mental health conditions that we have. After that, we'll look at the diagnostic manuals that are used in diagnosing mental health conditions internationally. Then we compare these diagnostic manuals. So as we want to continue, I ask the question, what is our understanding of mental health? And if I may ask, who hasn't slept well yesterday or last night? Did all of us sleep well? Did we sleep well yesterday?
Yes.
We did. Okay. Has there been times that of us have felt sad, and at another point we felt happy. If these are questions that we can answer yes, then we answer the question. We are on the verge of understanding what mental health is all about. So the question, I want to give a glimpse. Mental health is more than the absence of mental disorder. When we say mental health, most often people associate mental health with mental disorder. But mental health is more than just the absence of mental disorder. It is a concept that exists on a complex continuum which is experienced differently from one person to the next with varying degrees of difficulty. The need for action on mental health is indispensable and urgent. The need for mental health is undisputable and urgent. Mental health has an intricate and instrumental value and is integral to our health or well. What is the goal for this webinar or this session? This session seeks to give a general overview of mental health concept and mental health disorders, exploring the classification system, diagnostic, and mental statistical manual of mental disorders and in the ICD as crucial tools in the field of diagnosing mental health disorder and fostering a comprehensive perspective. We'll also be discussing the multidimensional nature of mental health, exposing emotional, psychological, encompassing emotional, psychological, and social aspects. We want to encourage critical thinking about the societal implication of mental health and then foster awareness and destigmatize mental health issues among the general public and enhance participants' understanding of common mental health disorders and their impact on individuals. And so this is the outline that we will be following or I'll be presenting on. We have an introduction, demystifying the misconception about mental health, defining mental health, and in defining mental health, we first look at what health is. Then we look at mental health issues, common mental health disorders. Then we will now introduce ourselves to the diagnostic manual for mental disorders. So why the need for this awareness creation? The need for action on mental health is indispensable and urgent. Mental health has an intricate and instrumental value and is integral to our well-being. Mental health is determined by a complex interplay of individual, social, and structural stresses and vulnerability. It forms an integral aspect of our overall health, influencing thoughts, feelings, and our behavior. Mental health is a human right. It is crucial to personal, community, and economic development. Having said this, to understand mental health in totality, we first have to even understand what health is. So what is health? Health is a multidimensional concept that includes different interdependent and interrelated aspects. That is health. Then how does the World Health Organization define health? World Health Organization defines health as a state of complete physical, mental, and social, and not merely the absence of disease or infirmity. According to the Constitution of World Health Organization, July 1946. But then there is a little twist, which was stretched in 1978 to include the ability to lead a socially and economically productive life. That is health. Then there is a fourth dimension of health, which is the spiritual well-being, one which transcends physiological and psychological. Health does not mean absence of disease, but it has a broader concept. Good health is a mixture of physical, mental, emotional, social, and spiritual well-being. Feeling of health can be with or without a disease. So now that we understand the concept of health, we'll now look at some misconceptions. Then we demystify these misconceptions that people have about mental health. There are certain misconceptions that people hold about mental health. What are some of these misconceptions? What are some of these myths that people have about mental health? First on the mind is that people do say that people with mental illness are weak. If the person were stronger, they would not have such a condition. So that is a misconception. Mental health doesn't mean people are weak, but the strong can equally develop mental health conditions. People with mental illness cannot hold a steady job. When we come to understanding mental health into detail, we come to understand that even people who are having mental health conditions are having stable jobs, but they have the condition as mental health, as a mental health condition. Some people also say that mental health is that an issue? Yes, mental health should be the problem of all, because whatever affects one person affects. From our definition of health, we have said that it includes the social well-being. So if somebody has a condition and that condition does not concern or it is not a problem to me, then that condition will later on have an impact on me. Seeking mental health care is a sign of failure. People say that if you are seeking mental health care, then it means you're a failure. You don't have to seek mental health if you are successful. Mental illness makes people violent. That when you are having mental health, you become violent. But the truth of the matter is that some people or people who suffer mental health conditions, some are not violent. In fact, they are more organized, they are more calmer than people who do not have mental health condition. Another one will say that if a person has a mental health condition, it means the person has low intelligence. That is not the case. Having mental health condition does not mean having low intelligence. You only need to take care of your mental health if you have a mental health condition. That is also a misconception, it's a myth that people that we have to demystify. Having a mental health condition doesn't mean you should take care of yourself. You must take care of your mental health condition, whether you have a mental health condition or you do not have a mental health condition. But at a point in time, we will come to realize that each and every human being on earth has a mental condition. Nothing can be done to protect people from developing mental health condition. That is also a myth. We can do something in order to prevent or protect people from developing mental health condition. Adolescents who get good grades and have a lot of friends will not have mental health conditions because they have nothing to be depressed about. It is also a myth. People who have good grades can equally develop mental health conditions. People who have friends can equally develop mental health conditions. So having good grades and having good friends or lots of friends is not a panacea of not developing mental health conditions. And lastly, we would say that people do have this belief that bad parenting causes mental health condition in adolescents. It is not this. Now, what is mental health or what mental health is not? From this slide, you realize that mental health is part of everyone. So we can say that if someone has a mental health condition, it is not my problem. Mental health is part of everyone. You can say that people who have mental health condition are specific people. Anybody can develop mental health condition. Something to look after. Mental health is something we have to look after. So we develop mental health condition before we start taking care of our mental health. Mental health is real and complex. It is a real phenomenon and it's a complex phenomenon. Mental health is really important. We have to take very good of ourselves. Mental health is really important. You can change. Mental health is something we can change. We can change it all in our head or in someone's head. It's not something you can just snap out. It is not something always. It's not something to change. Mental health. So, okay. Some say that mental health can be defined as a freedom from mental illness. That is not the complete definition of mental health. You say it can also be considered well-being or life satisfaction. That is a definition that is given to mental health. But according to the World Health Organization, mental health is defined as a state of mental well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, learn well, can work productively and fruitfully, and is able to contribute to his or her own community. So we ask ourselves this question: are we able to work well? Are we able to contribute meaningfully to the community that we find ourselves in? If we are not able to work well, contribute meaningfully, productively to the communities that we find ourselves in, then it's probable that we have mental health conditions. Mental health is a state that we find ourselves in. So at one point, we may enter into this state. At another point, we may leave this state. Who states that mental health is more than just the absence of mental disorders or disabilities. So when we say mental health, it doesn't mean if I don't have a mental disorder or if I don't have a disability, it means that I don't have a mental disorder or a mental health condition. Mental health is more than the absence of mental condition, mental health disorder or disability. Mental health as a state of well-being encompasses emotional, psychological, and social aspects of life. We will look at that. When we say it encompasses emotional, psychological, and social aspect of life, what does that mean for the individual person? So mental health exists on a complex continuum which is experienced differently from one person to the next. So what I experience as a person based on my mental health condition is different. We might have the same, we might be in the same environment, we might be in the same situation or condition, but how we experience mental health is different. So mental health it exists on a complex continuum, depending on how we handle the situation. It encompasses a range of aspects, including our thoughts, how we feel, our behaviors, and our abilities to cope with life challenges. We're able to cope with life challenges if our behaviors, our feelings, our thoughts are not in consonance with normal stresses of life, then we have mental health condition. Range from positive health functioning at one end through a severe of mental health condition at the other. So when we say mental health positive, that looks positive as at one point, but at another point or another end, we're going through mental health issues. So when we say these, what then do we say is mental illness? Because we are talking about mental health and there is also mental illness. We have to look at the distinction between the two. But then mental illness can affect anyone. One of the myths or one of the misconceptions that people have is that when you have good job, when you have good grades, when you have lots of friends, it means you cannot have mental illness or mental condition. But mental illness can affect anybody regardless of our age, regardless of our gender, regardless of our social status, whether we are poor or whether we are black, whether we are white, regardless of our religion, Christian, regardless of our income and our geography, whether we find ourselves in Kumasi, we find ourselves in the United States, we find ourselves in Rome, we find ourselves in China. Mental illness can happen at any period over the lifespan of human age, old age.
Please let's hold on a bit for Doc. I think he's experiencing some technical challenge. Doc, please, have you resolved it?
Please, sorry, I'm experiencing some technical challenges with my work. I hope we can all hear me again.
Yes, please, I can hear. Please, can we all hear him?
Yes, please, I can hear him.
Okay, please. Thank you.
Okay. So I was on the point that mental health can affect anybody irrespective of the age, irrespective of our gender, whether male or female, irrespective of our social status, whether we are rich, whether we are poor, whether we are politicians, whether we are lecturers, whether we are students, irrespective of our social status, irrespective of our race, whether we are Irish, whether we are Americans, whether we are Ghanaians, African, or whatsoever, irrespective of our religion, whether Muslim, Christian, Hindu, or Buddhist, mental health can affect you, irrespective of our geographical location. Accra, Kumasi, US, Ghana, Tamale, anywhere we find ourselves, we can develop mental illness at a point in time. But then we say that mental health happens, or we can develop mental health along the period of our lifespan of growth, from childhood to adulthood. It is possible that at childhood we may not have mental health conditions, but as we grow, as we journey along life, we may develop mental health condition along the line. Maybe at adolescent age or stage, we may develop mental health condition. If we don't develop mental health condition at that age, maybe at old age, we may develop mental health condition. When we come to the point where we are discussing some mental health conditions, we will know the various conditions that can occur or that can happen at each stage of life or each stage of our journey. What are the mental health indicators? There are certain indicators of mental health. And these indicators, we have already looked at it from the definition of health and from the definition of mental health. The indicators of mental health is that mental health is emotional well-being, such as perceived life satisfaction, happiness, cheerfulness. Mental health is a psychological well-being, such as self-acceptance, personal growth, including our experiences, optimism, hopefulness, purpose in life, control over one's own environment, positive relationship and direction. Mental health is social well-being, our social acceptance, our belief system in the potential of people, and also our own, and also our spirituality or our self-direction. That is on the psychological point of view. But on the social point, our sense of community. What is the sense of the community? So our sense of community is also an indicator of mental health. The social determinant of mental health include adequate housing, safe neighborhood, equitable job or wages, quality education, and equity in access to quality health care. So these are the social determinants of mental health. What determines our mental health from the social spectrum or from the social point of view? If we have safe neighborhood, we are okay. If I find myself in a neighborhood which is not safe, I am not able to sleep. I am worried. I am depressed. I am anxious, which means that I am developing mental health. I for an individual an indication to because we don't have housing, so you are not safe. Will I get employed? Will I be employed? If I am thinking about all these things, and these things puts me in a depressive mood or puts me in a state whereby I am not able to sleep, I am not able to function properly in the community or environment I find myself, then it is determining how we feel in or in our health system. Then quality health care. If we do not have quality health, it also is an indication of mental health. So, or risk of self-harm. People with mental health conditions are more likely to experience lower levels of mental well-being, but this is not always on. So I want to now look at the types of mental health conditions. There are so many types of mental health conditions. We have depressive disorders, generalized anxiety disorders. We have obsessive compulsive disorders, we have schizophrenia spectrum disorders, personality disorders, and then post-traumatic stress disorders and substance use disorders. So I want to take it one by one. What are some of the major depressive disorders? We have depression, which is a mood disorder that causes a persistent feeling of sadness and loss of interest. We have generalized anxiety disorders, that's anxiety disorders. That is a mental or behavioral disorder, specifically an anxiety disorder characterized by excessive, uncontrollable, and often irrational worry about events or activity. We have obsessive compulsive disorder, which is also a mental health condition where a person is has obsessive thoughts and compulsive behavior. OCD can affect men, women, and children, known as schizophrenia, a mental disorder characterized by delusion, hallucinations, disorganized thought, speech, and behavior. We have personality disorders. Typical example is borderline personality disorders. That is a mental health condition that impacts one's self-image, emotion, and relationship, which affects how a person thinks, feels, and relates with others. Then we have borderline disorder, a serious mental illness characterized by extreme mood swings, which can also include extreme excitement episodes or extreme depressive feelings. We also have post-traumatic stress disorders and substance use disorders. So when someone who, for instance, has been raped or has witnessed a horrid or a gory accident, that person sleeps and then begins to experience the emotion, the things that the person had witnessed, and is laying out in the person's own life. That person experiences what a disorder is, which is an anxiety disorder that may develop consequent to exposure. It's one of the most common neurodevelopmental disorders of children. It is usually first diagnosed in children and often lasts into adulthood. Oppositional deficient disorder, ODD, is a condition maintained psychosis. Is a condition of the mind that results in determining what.
Doc, please.
I am reliably informed that you can hardly hear me.
Position
Can you hear me now?
yourself well. I'm fine if you call to hear you.
Please, can you hear me well now?
Please, is it better?
For now, it's better, but as he
As
progresses,
he starts progress, okay. Doc, please, can you hear us?
Not at all. My network is unemployed.
So sorry about that. So let's all relax. Remember, we are talking about mental health. So this is all part of the process. This is all part of the process. Trying to remain calm in disturbing situations. Please, let's all exercise some little bit of patience for Doc. He's trying to resolve it. Doc, please. Is it better? Are you okay now? Hello. So I think Dr. Aaron has been able to resolve his issue. So sorry about that. It's good actually. I mean, we are talking about mental health, so ways and means to deal with distressing situations. This is one of them. Dr. Aaron, please welcome back online. Thank you. Doc, please, I think we can hear you.
Can you hear me now, please?
Yes, please. You are. Yes, please.
Okay. All right. Okay, so we were looking at the types of mental disorders. So I did say that some of the mental disorders that we have are that we have major depressive disorders, which are mood disorders. And depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. We also have generalized anxiety disorder, which is a mental and behavioral disorder, specifically an anxiety disorder characterized by excessive, uncontrollable, and often irrational worry about events or activities. So where somebody has this excessive worry or uncontrollable, irrational worry about an event. I am attending an interview. I have a lecture to prepare, or I have a lecture to deliver at 12 o'clock. but it's 11:55. I am stuck in traffic. So I enter into an anxiety mood. I am worried excessively. How am I going to do this? How am I going to do that? What time will I get that? That is a type of a mental health condition. We also have obsessive compulsive disorder, a type of mental health condition where a person has obsessive thought and compulsive behavior. OCD can affect men, women, and children. So when you say obsessive thought, what you are thinking about is upset. What you are thinking about, your behavior is so compulsive. Everything is to you yourself. So it can also happen to men, women, and children. We have schizophrenia spectrum disorders, schizophrenia, which is a mental disorder characterized by delusions. I am having delusional beliefs. I have certain thoughts which are irrational, hallucinations. I can hear voices which does not exist. I see visions. I see things which are not in existence. I feel there are some animals or ants all around my body which are not there. We have disorganized thought. The way you are thinking is disorganized. You are saying one thing before you realize you are saying a different thing. So everything you are saying is disorganized. You have speech and behavior, blurred speech and behavior. So whatever, when you are speaking, your speech is blurred, it's not coherent. So it is a sign of a mental disorder. We have personality disorders. And a typical example is borderline personality disorder. So borderline personality disorder is a mental health condition or disorder that impacts one's self-image, the way I see myself, that impacts one's emotions, that impacts one's relationship. It affects how a person thinks, the way you are thinking. It affects the way I feel. It affects the way I relate with others. That is a borderline personality disorder. And we have bipolar disorder. What is bipolar disorder? Which is also a personality disorder. It's a serious mental health illness characterized by extreme mood swings. In the last 5 minutes, you were happy. In the next 5 minutes, you are sad. So mood swings. My mood is swinging. Happiness, low mood, happiness, sad at one point. Then we say you are bipolar disorder. They can include extreme excitement episodes or extreme depressive feelings. When we say extreme episode of or extreme depressive feelings, you are excessively sad. That one, you are having depressive feelings, or you are having excitement episodes. Your excitement level is heightened. One breath, you are excited, at another breath, you are sad. So you are experiencing bipolar disorder, which is also a mental health condition that many of us do feel. Please, can everybody hear me? Okay. So
yes, please, Doc. But we have some questions. So
yes, I want to ask you a question first. So how many of us as participants have experienced the fact that at one breath, maybe within an hour, I have been sad, or my mood has extremely been elevated, and at another breath, my mood has extremely gone down, or I have felt excessive depressive feeling? How many of us have had such an experience?
this one is just the norm of the day. Every day we face this challenge.
Every day we face this kind of experience, right?
Yes, yeah.
Then can we say, therefore, that we have mental health conditions?
To be honest with you, I think that each and every one in life, one way or the other, are facing mental disability or mental health condition.
Okay.
But it varies from one person to another.
Okay. Has there been an instance whereby we have felt extremely uncontrollable behavior or irrational worry about an event? Irrational worry about an event. You are attending an interview and you are so worried that overnight you are not able to sleep. You are not able to eat. You are sweating profusely. Your whole body is shaking. Have we felt that at one point in life?
Can I talk?
Yes, please.
Please. Talking about interview, personally, me, I've never experienced that before, but aside interview, another aspect, event in life, I have experienced this kind of mental health condition that you are talking about. For instance, one I remember some year back, I was called to go and deliver a talk. And but the talk was given me late. I wasn't well prepared. So and it worried me a lot. And I don't have enough time to prepare. But the subject in which I need to talk about was a little bit difficult for me. And then but I was selected to go and give that talk. And since I wasn't well prepared, I was, and I don't know exactly my audience very well. And then it was a challenge, a big challenge for me. The whole night I was thinking, and when I'm thinking, I don't know what to prepare. No, it's a very big challenge for me at that time. Thank you very much.
Okay. So at another breath, if I may ask this question, has there been a situation whereby you are living with somebody or you are living with people and they tell you that, as for you, your attitude, your behavior is weird, and you are not able to live with anybody. People who come to live with you 1 day, 2 days, then they are gone. You are there when somebody enters your house and leaves, you pick a broom or you sweep behind the person. You are there when somebody is saying something which is not related to you. You are thinking that the person is talking about you. You are having this feeling that somebody is talking about you. Have we experienced this kind of situation before?
Personally, the first one, I think is the opposite for me, because if you live with me or I want to live with you love to live with me. That is my behavior. I don't know. I like women being like, sociability and all these things. My character, I don't know. Anyone who comes closer to me like to stay with me. That is personally, that is my, let me say, my attitude or my behavior. But sometimes, in society or in group, especially me, I'm a French teacher, and sometimes you enter the class, you are teaching and all this, you see the students are laughing and you don't know what exactly they are laughing about. You may think that maybe the way you dress or your posture or I don't know, but we experience such events or
Okay.
conditions sometimes.
Thank you very much. So all what we have said or you have said, when you put them together, is an indication that we all sometimes experience mental health disorders or mental health conditions at one point in our lives. Now we want to look at the diagnostic manual for mental health condition. If we want to diagnose somebody of having a mental health condition, how are we going to know that this particular condition is this? And what is the indicative factor for diagnosing somebody with a mental health condition? So there are two manuals that both psychologists and psychiatrists do use in order or helping us to be able to diagnose psychological or mental health conditions. These diagnostic manuals, they are two in number. We have the DSM and we have the ICD. The DSM simply means Diagnostic and Statistical Manual of Mental Health Disorders, DSM. It is a handbook used by clinicians and psychiatrists to diagnose mental health conditions. What is its history? It was developed by the American Psychiatric Association provides a standardized criteria set of diagnosing mental health conditions with a purpose. Its purpose is to provide clear and detailed definitions, examples, and categories of mental health and brain-related conditions. There are 34 of such. It classifies disorders based on symptoms, severity, and then its duration. It assigns codes to a mental health conditions so that you are able to know. We have DSM 3, 4, and currently we have DSM 5. The DSM aids, it helps clinicians in making accurate and consistent diagnosis, ensuring effective treatment planning. It is the most widely used diagnostic system for mental health disorders in the United States and in many other countries around the world. Now, the second one is the International Classification of Disease, that is ICD, which is the global standard for diagnostic information, health information. We looked at a DSM, which was developed by the American Psychiatric Association. But now we have the International Classification of Diseases, which is a manual designed by World Health Organization, which is a standard one for diagnostic health information system, which serves as a broad range of uses globally and provides critical knowledge on the extent, causes, and consequences of human diseases and health worldwide via data that is reported and coded with the ICD. So the ICD also assigns codes to certain mental health conditions, which is compared with that of the DSM, and a clinician or a psychiatrist is able to arrive at a proper diagnostics, and then a treatment planning is formulated on the particular case that is presented. I want to look at the purpose of the ICD. As a classification and terminology, the current ICD that we have is ICD 11. It has also moved from various revisions up to the current state, which allow the systematic recordings, analysis, and an interpretation and comparison of mortality and mobility data collected in different countries or regions and at different times. So when the ICD uses data from Ghana, data from Nigeria, data from South Africa, and they put it together, and from there they are able to assign a code to a particular disease, a disease or a disorder based on the symptoms that each of them presents. Then, having looked at it, then we look at the differences and similarities between the DSM and the ICD. Both DSM and ICD are extremely comprehensive classifications. They cover all areas of mental health. So if you pick DSM and if you pick the ICD, they both cover comprehensively all the areas of mental health within the spectrum. For example, it covers the areas of neurodevelopmental and associative disorders, somatic symptom disorders, sexual dysfunctions, paraphilic disorders, and personality disorders. Psychology, for which is my field, is built on a classification system of disorders. So without this disorder, this code or this manual, we might find it very difficult assigning a diagnosis to a particular disorder based on the criteria. This means that from a series of psychopathological traits or symptoms, specific disorders or conditions are constructed that define cognitive economics or cognitive functioning. So, in the case of the ICD, the disorders are established by the World Health Organization, whereas the DSM was developed by the American Psychiatric Association. After being improved, the current version, that is the ICD-11, perfectly addresses gaps of ICD-10, which incorporates medical updates, discoveries, and certain changes in thinking. There are also specific updates related to enhanced coding structure, international usage, digital readiness, and useful facility. So for us as participants and for us to enhance or to create more awareness about mental health, we say that we have to identify the signs. That's the importance of recognizing mental health issue when we should reach out for help. So it is important and instructive that the Wellness Center of KNUST and the Department of Behavioral Science is collaborating this particular program. So when we are having any signs of mental health disorder, if we are having insomnia, difficulty sleeping, either you are sleeping too much or you are sleeping too less, it is a sign of mental disorder. If we are not able to eat, either we are eating too much or we are eating too less, it's a sign of mental disorder. If we're extremely anxious or we are worried so much about events or situations in life, it is a sign of mental health disorder. So if we're experiencing any of these symptoms or any of these signs, it is a call or it is a time for us to call on a professional, a clinical psychologist or a psychiatrist or a mental health worker who will give you the assistance that you may require. Now, we have to prioritize our mental health. It is very important to prioritize our mental health because mental health is a human right situation. So we have to prioritize it by taking very good care of ourselves, eating well, sleeping well, exercising more so that we can keep our health. For there is no total health without mental health. Without mental health, we can never have total health. Total health is mental health. Thank you so much. And now your questions are welcome.
Thank you very much. Thank you very much, Doc. That was an amazing presentation. And right through it, we experienced firsthand how to deal with our mental health. There were hitches here and there, and we had to stay calm through it all. I think that's a very good training ground for us. Please, the floor is open for questions. If we have questions, we just pick like 5 questions because we are way behind time so that we can wrap up. You can equally drop your question in the chat for me to read. Please, questions. If there are no questions, can everyone hear me, please?
Yes.
Hello.
That's great. Yes.
Hello.
So, hello.
Yes. Good afternoon.
Good afternoon, please.
Yeah, I would like. My name is Nicolas Santos. Thank you very much, Doc, for your amazing presentation. I have 2 issues. The first one has to do with the last point that you just developed about we need to take care of our mental health. That is fine, but there are situations sometimes who, let me say, supersedes our personal control. For instance, somebody who is who has completed, is a graduate looking for a job and is not getting the job, but there are issues that you need to attend to and you're not getting the job. At that moment, it's so difficult to control yourself because there's a need. You need something. You are in need of something. And what you need at that point to get job or to get money to solve a problem and you are not getting the job, at that point, how can we control our mental health? That is number 1. Number 2, after the presentation or during the expose, you didn't talk about any approach or solution when we are facing this kind of challenge, because I said it earlier on that whether we like it or not, each and everyone in our day-to-day activity, we face all these things. Today you are happy, tomorrow you are not happy. Sometimes you don't know the cause of your why you are not happy. You wake up and then you are not feeling, you are well, physically you are fine, but your emotion, your mood is not fine, and you don't know. You didn't give us any approach or solution in that moment. So thank you very much, Doc.
Thank you, Mr. Nicolas Santos, for your
Yeah, my
question. Let me start with your last question. You know, that is why in my presentation, I have said that I just gave some few signs and symptoms of mental health. If we are excessively worried about life or events, if you are sleeping too much or sleeping too less, or any sign of mental health, I did mention that get in touch with a psychologist, get in touch with a psychiatrist, or get in touch with a mental health professional who will be able to understand what you are going through and then help you put yourself together. So I said, mental health is an issue. When should we reach out? You have to reach out when you see the signs that there is a clinical psychologist. I have to go there and the person will give me the support that I need. I did mention that we have to sleep well. We have to eat well. We have to exercise. Sometimes some of the food that we eat, our menu, causes us mental health. Sometimes lack of exercises causes us exacerbate our mental health condition. So as an individual, we have to engage ourselves in exercise, because exercise frees the mind, because everything is about the mind. Once we are exercising, our mind becomes free and we are able to live more healthier, or we are able to live a life that is able to give us peace of mind. Now, the next question is relative to the fact that you have graduated from school.
Clear. We want to see your face.
You have graduated from school, and now that you have graduated from school, you are not able to secure a job. So if you are not able to secure a job, it is giving you problems, or you are worried about that situation. Yes, I did mention some of the social determinant of mental health. I say job, good job, good health care, and then all these things. If you have graduated and you have not been able to secure a good job, and you are going through these anxiety or stress, all you still need to do is exercising, meet a psychologist, a psychiatrist, a mental health officer who will teach you the tips of managing your stress. This is not a stress management presentation. We would have looked at the source of stress, and then we now look at the management of stress as we would have. So there are techniques in managing the stress or the anxiety that we find ourselves in a situation like that. But if you are going through some of these things, reach out to a psychologist, reach out to a clinical a psychiatrist, reach out to a mental health personnel or a mental health officer. They will give you the guide or the resources that you require to be able to put yourself through and have your total well-being. Thank you.
Okay, so I see. Thank you very much, Doc, for that response. I see in the comment section, the chat, that someone wants to know the stages in mental health. So that was exactly the focus, but then I can quickly brush through for you. So
Okay.
there's for some books they have the preconception stage, there's the contemplation stage, maintenance stage, preparation stage, action, making a change, and then mental illness education, and then stability and recovery. So that's something you can look up on your own. Anyways, Doc wasn't focused on that. However, another follow-up response that I would want to give to the one who has the question is that in a subsequent engagement, we have all these things planned out. I think our next presentation is on social anxiety, and you get to know a whole lot about anxiety issues and then how to deal with it. I don't know if there's any other question. We can take that, then I can wrap up.
Hello.
Yes,
Hello.
please. Yes,
Yeah.
please.
Dr. Just thank you so much for your presentation. I think that you did a great job of showing how all of our mental health is intertwined. So there isn't one easy answer to everything, but I do think one of the keys is developing a practice around your mental health. As you mentioned, working out and sleeping well, but also just having strategies for how you view the things that are happening in your life. So we will always have things that are out of our control. But if we can start doing preventative maintenance with ourselves and learning as much as possible about how to view those things, how to react when those things come up, I think that's where we win as individuals. So you don't have to wait until you have an issue, or you don't have to monitor, as closely, oh, am I borderline having a mental issue or not? But if you're doing that preventative maintenance, then you find yourself more aware of where you are on the spectrum. Thank you.
I totally agree, and thank you for your input as well. I totally agree with what you said. Please, do we have any other questions? Okay, so I think we've gone way beyond. I don't know if Miss Ruth Frempoma, did you have a question? I had to mute you because there was so much feedback from this end. Oh, okay. Okay, so in our next presentation, we'll be meeting another lecturer from the Behavioral Science Department, and the current head for the psychiatric unit at Komfanoche Teaching Hospital, and then the immediate past president of the Psychiatric Association of Ghana. Another interesting personality. The first time I met her having a lecture with her students. It was all fireworks. The woman was all over the place. I mean, making the entire place so excited. So I'm really looking forward to that presentation. I pray you also join us on the 29th of February. This webinar happens just once a month, the last Thursday of the month. So just the last Thursday of the month, come and learn something about your mental health. The last Thursday of the month. On the 29th February, we'll get to know something about sleep, and then maybe an overview of anxiety that can be intertwined with it. Until then, thank you very much for joining us this month. And once again, if you want to know your mental health status, as I said earlier on, before the webinar, we'll be assessing ourselves on our mental health status. So you just drop your email in the chat. We'll send you, this is assessment at your doorstep. You don't need to move from where you are. Just stay where you are. Just give us your email. We'll drop it in your email for you. You respond to them. Then we'll give you feedback on your mental health condition so that you are better prepared. You know what to do to help yourself. If you have any other thing you'd want to reach out and then discuss with us, we are open. We are available for that discussion as well. Thank you very much for joining us this month for the Psych Gist webinar. If anyone can get us a slogan for the Psych Gist, I'm really interested in it. Kindly get in touch, and then let's acknowledge you for getting us a slogan. Thank you very much. Have a nice day. Bye-bye.